Well, good evening. Welcome to the Autism Program's webinar on picky eaters, tips and strategies. This webinar is funded through the grant through the Autism Program at the University of Illinois. I'm Linda Tortorelli. I'm the coordinator of the program. We're really happy that you're taking time out of your evening to join us. We have Dr. Aaron Abada, who is working behind the scenes and keeping our technology going this evening. So we thank him for his expertise and support. Jeannie Kramer is going to be facilitating our webinar this evening, and we welcome with great enthusiasm Lisa Crane, who is a speech pathologist, and she's going to be sharing her expertise about picky eaters, tips and strategies, particularly for those individuals on the autism spectrum. So I hand it over to Jeannie.
Good evening, everyone. We're so happy that you're here. Before we get started with introducing Lisa, I wanted to talk to you a little bit about how the format of the evening will go. We plan to listen and learn from Lisa as she presents her knowledge about feeding disorders. And then afterwards, we will be opening up a Q&A session. I'd like to teach you a little bit, for those of you who aren't familiar, because of the number of people who are in the event, are keeping everyone's cameras and microphones muted. So cameras off and microphones muted. And you will be using the chat in order to ask us questions. So if you're not familiar, if you take your cursor and hover over the presentation, you will see that there is an icon at the bottom that says chat with a talk bubble. If you tap on that, you will see someone already typed in hello everyone. And so we're going to do a test. Hello from TAP. I'm going to shout out the Illini battle cry, and you all answer me in the chat just to make sure it's working. ILL. All right. Anyone else? Yeah, okay, good. We see you all. We're happy that you're here. We will be very specific as to when the Q&A starts. If you can hold your questions until the end, we have the list of questions for those of you who registered and gave us questions. We have that list, and Lisa will be addressing most of those during her presentation, and then during the Q&A, I'll be monitoring the chat, and if you can hold your questions until that time, I think Lisa's going to answer a lot of good questions while she's presenting. So without further ado, I would like to introduce my friend and colleague, Lisa Crane. I have known her for the past 15 years. We do go back that far, Lisa.
We do.
Yes, and Lisa is a speech-language pathologist with 30 years of experience serving with communication and swallow disorders. She is the former director of the clinic at the University of Illinois and currently serves as a senior speech-language pathologist at Carle. Her specialty is in dysphagia, which is a fancy word for swallowing problems, and with a real area of expertise in pediatric swallowing, feeding, and eating disorders. So Lisa, I will turn it over to you. We thank you so much for sharing your expertise and look forward to everything that you have to say.
I just had a little listing of the places that I've worked prior. So I've been in the Chicago area for a while, I've been in Ohio, and have been in Champaign area since 2002. And I also have a private practice where I do mostly early intervention services for kids with speech and language and feeding issues. So let's get started with what is a picky eater. So there are a lot of different people, kids that are picky eaters, adults included, eating only a small number of foods, difficulty accepting new foods, difficulty with changes in mealtime environments, hypersensitivity to food, that includes like textures or tastes, or smelling. Maybe they're super tasters where they can denote differences in the brand of food that they're given. Only Kraft mac and cheese, only Panera mac and cheese. I've had kids that can tell the difference of the mac and cheese. And also very strong food preferences. Many of the kids have a small finite set of foods that they will eat. So I found these on. Hello, my name's Olivia, and I won't touch anything on my plate, but will eat anything I find on the floor. Hello, my name's Lexi, and I'll gag at the sight of sauce, except if you call it frosting. I love pasta frosting. Hi, my name's Caden, and I'll only eat chicken nuggets if my mom picks off all the breading. Don't think you can fool me by making unbreaded chicken in the shape of nuggets. There's something I really enjoy about watching the bread picking off process. So there are some kids who have very specific things that they do or that they eat. So a couple of our picky eaters here, and I'm sure that all of you watching know someone or have a child that is a picky eater. So some factors to consider. First, I want to take a look at, are there any underlying physiological issues? So constipation. If kids are constipated and they haven't had the food go through them and they're bloating, they're not going to want to eat. If there's chronic congestion, they have a reduced sense of smell, so they're not smelling things typically or tasting things the same, so that can hinder what they want to eat. And you may see during that time that they want something more bold, more flavors that are bolder during that time because they really can't taste things. There may also be some food allergies or intolerances. Several of the kids that I work with, 70% of my caseload at Carl is feeding. And there are different food allergies. Many lately have been dairy. They don't know yet that the child is allergic to milk or dairy products, or the lactose in the dairy, or the milk protein. There's several different areas. Gluten and eggs. Those are the main ones that are some of the things that the kids are allergic to or we find out later. And it's hard to get a child to eat different things if you're not sure if there's an intolerance or a food allergy. And eczema I have listed on there is a good indicator that there's some type of food intolerance or allergy going on. Structural issues, there for the kids that gag a lot or only eat certain consistencies of food, which we'll talk about. There could be structural issues going on. Very enlarged tonsils, adenoids, which we can't see visually. The ENT needs to go in and look, but there can be enlarged structures where for some kids it's not a problem. With other kids, if some of the food gets touched or gets stuck near where the tonsils are, that can be something that puts the kids off and then they won't eat certain foods. And also reflux for kids that have been throwing up a lot or vomiting, or that acidic feeling in the throat, are not going to want to eat certain foods or not going to want to swallow some of the foods because of how it feels or what they've been reminded of. So those are just some things that we need to look at to make sure we rule out before we start working with kids in order to build their repertoire of foods that they may eat. Other referrals I listed here, pediatrics, you may see a gastroenterologist. If you're talking about bowels and reflux issues, there's also the nutritionist who can talk about more calories for foods and how different foods can help gain weight or help be more fibrous or help with any of the there are some kids that have very low iron that can mask and have them not want to really eat a lot of foods. And we learn that there's less iron in their system. Otolaryngologist, ENT, can look at the structures, and occupational therapist if there's a sensory processing function going on. So those are some other areas, other people that may be involved. So what is oral aversion? Well, the medical definition is a reluctance or avoidance or fear of eating, drinking, or accepting sensation in and around the mouth. So some kids are that I've worked with are really fearful of eating and don't want to eat a variety of foods, may eat only purees, may eat only certain color purees, may not want to eat anything that has chunks in it or that has to be chewed a long amount of time. So there's different ways of looking at oral aversion than just pushing away and turning away. We want to find out why. Why are they turning away? So I also want to talk about a little bit between gagging and choking. So gagging is usually a sign of stress. The food can trigger the gag. Usually the gag will start in the middle of the tongue, work back. I've seen kids gagging and that little piece of food is right in the center of their tongue and they're trying to move it and trying to get it off. They can also gag because of poor oral motor skills. Again, the tongue can't get it off. They can't move that piece of food around. There are sensory issues, the feeling of it, or previous experiences. It can be a smell that gets them to gag. And then choking is when a piece of food actually gets lodged. So it's not really predictable, choking. Like, you know that there are foods that kids can choke on, but sometimes you can predict the gag. Oh, I know he's going to gag on this food. Oh, he's probably going to gag when he smells this. But choking is there's difficulty breathing, and you'll notice some facial changes, watery eyes, redness of the eyes. And we know that some kids aspirate food, and those are also some signs of when a child can aspirate food. We have some sensory challenges as well. So there are some kids that we'll talk about that as soon as they see the food, they don't even touch it, they don't even smell it, they just look at it and they're not eating it. There are kids that will come in and say, "Oh, what are you cooking? That smells terrible." And they'll have super smell and not want to eat the food. Also, then there are kids that will actually put it in their mouth and then don't want to eat it anymore, spit it out, or then you see the gagging. There are kids that don't even want to touch certain foods, that, "Ew, that looks gross," or "Ooh, as soon as it gets on their fingers, they want to wipe it off," or they don't want to even, they have to have the fork, they have to have the spoon, they're very neat, but they don't want to actually touch it with their hands. And then there's texture, which is a lot of kids that I work with as well have a lot of texture issues. As soon as there is a lump in something, many kids are stage 3 baby foods. If you remember, for those of you with older kids, is when they make the stage 3, they have to have really puree with a harder piece of pasta or whatever that has that consistency so it doesn't get slimy in the process. And so a lot of kids don't like that stage, and so then it's time to move on. And there's other kids that have texture, if it's chewy too much or if there's too many different consistencies at one time, kids will often not eat it. So some points to keep in mind. Appetites can vary. So you and I both, there are some days where we're ravished, we are really hungry. There are other days when we're not so hungry and we will eat lightly, have a really big breakfast and not really be hungry for lunch, or have a big lunch and not really be hungry for dinner. So remember, think about those things. We used to say if kids have 2 good meals a day, 1 really good meal, 2 good meals a day, they're doing great. Taste can vary. So sometimes the kids will like something one day and then not like it the next day, or like something one time and for some reason not like it again. Maybe it's a different kind, maybe it was cooked differently, maybe the flavor was off, but taste can vary. And somebody will say, "What do you want for dinner tonight? Do you want Chinese?" "No." "Do you want Italian?" "No." "I think I'll just have a PBJ." So taste can vary too. The average meal should take between 20 and 30 minutes. That's about the time that your brain tells your stomach it's full. So for those kids after that 20-30 minutes, really not going to get a lot of food in past that time. So a lot of times it's not wise to have them sit at the table for an hour or sit at the table for 45 minutes. You know your child best, but think about that and about how long it takes the brain takes this to tell the stomach that they're full. If you cater to preferences, which we'll talk about a little later on, children are less likely to expand their variety. And so if you keep offering the same foods and the same foods and the same foods, then they're not going to eventually not want to eat anything else. So we'll talk a little bit tonight about different strategies that we can use to help expand their variety. Kids will try new things more often when they're hungry. And especially when I see kids in sessions, I will ask that they be a little bit more hungry, not starving, not that they haven't eaten in 8 hours. And some people will say, well, they haven't had anything this morning. They really weren't hungry this morning. That's one thing. But if they just ate, or wow, he just had a bottle on his way here, or he just had a sippy cup of milk on his way here, I know that I'm probably not going to make a lot of progress at that session. So when the kids are hungry, and most of the time kids are hungry at breakfast. So everybody wakes up a little bit dehydrated, everybody wakes up more hungry, unless there's a feeding tube or unless there's other types of food that's been given overnight. But the kids usually are more hungry at breakfast. So you may be able to make some changes more at breakfast. So let's talk a little bit about the environment. So location of the meal. You may want to think about the lighting if the kids aren't eating at all. Is it too bright in the room? Does the lighting bother them? Some kids on the spectrum have issues with lights. I had one little boy that I worked with that we could only try new foods under my table. So it was almost like we were in camp and we were sitting on a table and trying new foods. If we sat at the table, he wasn't trying it. He wasn't gonna participate. The lighting was dimmer. It was not as stark in my room. So we made a lot of progress under the table. What table are you using? Is it an adult table where they're in a chair where their feet are dangling and they're constantly moving and trying to keep their body still, so they get less interested in eating the food and don't want to eat because they're not sitting still? So you may want to think about for the younger ones, a kid's table where the feet are firmly planted. If your feet are on the ground, then you're more likely to increase your attention span. There could be distractions. There could be lots of noise in the area or visual distractions, other things going on that they're not interested in eating because they want to see what's going on in the other room. Also, aromas can be positive or negative. It can draw kids in, or can say, "Ooh, I'm not eating. It smells like burnt popcorn in here. I can't eat." So we have to think about those when we set the environment for the meal. Some other suggestions are keeping a schedule, and especially in this time, it's good to try and keep to a schedule. I know it's not perfect, and I know it's easy to get off schedule when you're home, but keeping even a visual schedule with the kids is helpful to know, so they know when the snacks are, when it's time to eat, what's coming up next. Studies have shown that eating and snacking at a specific time can keep kids on and keep kids more wanting to try than just having food available all during the day. Whenever they're just a little bit hungry, they get some food, and that's what we call grazing. And grazing is hard to make changes when food is available all the time for the kids. So wait, we're going to eat in a half an hour, we're going to eat in 30 minutes, or snack is not for another hour. I know you didn't eat much at breakfast, but you got to wait a half an hour more, and then we're going to have a snack. Sometimes knowing when, sometimes setting a timer, and then they know when the timer goes off that it's time to have a snack. Eating meals together when possible. I know that's been happening a little bit more in this last month. So modeling eating, having kids just sit there and you eat separately, or you do something one meal a day. If you can eat one meal a day together, that's it helps kids to try things, to eat, and any kind of attempt, oh, that's great. Sometimes drawing attention, though, to some of the kids that I work with, you have to kind of like let it go. And if you draw, oh, you ate the orange, and then they don't eat the orange anymore. So it's kind of a fine line to figure out what to talk about or what to do during the meals. You also may want to change the environment at times. Like sometimes you might want to have an indoor picnic, throw a blanket out on the floor and put the plates on the floor. You might want to look at a low table and eat at the low table without chairs and bring things to the table. Just sometimes changing it up can help, and sometimes changing it up can't. So you'll know your child best if this could work. And music, sometimes playing soft music, sometimes classical music, sometimes kids' music will help with eating and digestion. Participation is really huge. Helping to shop, although we can't do that exactly right now, they can help decide what to buy. Point at things, tell you things. What food do you think you might want to try? What new food? Maybe something they saw somebody eat, and maybe something on the TV. I've had some people put on Food Network shows so they can see different ways of cooking and different foods, and what do we want to try and cook that somebody cooked, or what do we want to try? And then helping with meal prep. And that can always be fun. So we've got different people helping with meals. It can be helping making their own. It can be just looking at the different fruit when you're cutting it. It can be helping, the little boy's helping roll out the dough with his mom. So anything that you can get them to do when you're preparing the meal can help. And I listed like locating the food. Where is the food in the pantry? Washing the food, measuring and stirring. Kids love to be in the water. Washing some of the food off, measuring or stirring, and knowing that messes are okay. We'll clean it up, throw a plastic sheet down or a plastic tablecloth down so you can have easy wipe up. Pushing buttons on the microwave, setting the table, putting in serving bowls, putting stuff in a different bowl or on a plate can be helpful too. And then the actual meal, giving them choices with which utensils they want. Which plate do you want to eat today? Which fork? Is there a fork or a spoon that they want to use? I've had some kids that don't want any forks, that use their hands, and I have other kids that need like a cloth at the table so they can wipe their hands off if their hands get messy. Serving others, sometimes they can go around and give everybody this snack. You start it at snack time and have them be in charge of giving everybody else the snack. And I've also worked with some kids with a second plate approach, and we'll talk a little bit about this later, but it's where you have a plate of food that you want to be eaten by the child. So you have the plate of the food on it, and then you give them a separate plate, a second plate that's empty. And they get to take the food from that plate, from the first plate onto their plate. And so there are some kids where that plate right there looks like a whole lot of food, way too much food. And so if you can bring it on a second plate and they get to pick what they want first or how many they want at first, can also help. And a lot of times food, if you have a big plate of food and the kids think, oh my goodness, this is huge, this is way too much food, I'll never be able to eat that, I'm not eating any of it, that is just too much food. So we reduce kids who visually refuse food, we reduce the amount of food on the plate. And sometimes really significantly, if we're trying in therapy, is we'll have one pea, one carrot, and here's the plate of all the foods that we're eating tonight, but here's your plate. And we're gonna put one of everything on your plate, or you get to take what you want. What do you want to eat first? Which thing do you want to eat first? A lot of times reducing the size of the food pieces can be helpful. I have taken a baby carrot and cut it into 4 to 6 slender pieces. Sometimes the chewing, sometimes there's an oral motor weakness and they can't chew that carrot, or it's really hard to bite through the carrot. So they don't want carrots. So they don't want it raw. So we've cut them into very narrow pieces, and those are better able to be chewed. You don't have to chew it as long. You're more successful with it. Meat as well can be cut into small pieces. I often tell the kids, chew, chew, swallow. So a piece that just has to be chewed a couple times that you can swallow will be helpful. And also, a lot of times giving a child a whole sandwich. Now you have kids that don't want it cut, but the other kids, you can try cutting it into quarters. I can eat that quarter of the sandwich. I can't eat that big sandwich, but I can eat one of these pieces. And then pretty soon they're taking bites of all 4 of the quarters. So again, reducing the size of the food can help. Melanie Potok is a speech pathologist who works in feeding disorders, and I have her information at the end of this talk online. And she encourages kids to have a tiny piece of what's being served on their plate. So if you're having tacos tonight, and they're like, oh, I only eat this and this and this of the taco, having even just a little piece of the taco shell, a little piece of the tomato, it might be a dab of the taco sauce, a shred of cheese, 1 shred, so that they're used to seeing that on their plate. Now, maybe they don't have to eat it. Maybe they'll just try it. Maybe they'll just put it to their lips, but they've had it. Some kids, it's just having it even on the plate is a step in the right direction. So that can have kids used to it. Sometimes it's just having it on their plate, and it's on their plate, and it's on their plate. There are kids with specific tastes. So certain tastes can be alerting. So there are bitter and sour tastes are more alerting. So if you want to wake yourself up, smell some grapefruit, smell some citrus, smell some lemon. And calming tastes are more sweet and savory. So those are the feel good. And for some of you, it's the mashed potatoes and gravy. That's a calming comfort food. And they're usually either savory or more on the sweet side. Some kids prefer bold flavors. You may see kids that, I ask what they eat. Oh, they eat barbecued potato chips. Oh, they eat other food. They'll have vinegar and salt and vinegar chips. And they like we had this curry and it was spicy, but they really liked it and wanted more of it. So you want to take a look at why are they wanting the bold taste? Do their taste buds need to be ramped up and they need more flavor to just taste like we would taste a typical, some people like really hot stuff. If you had hot things when you were pregnant and spicy things, then they can pretty much tolerate some of that spicy things. They've been used to it a while. Some kids prefer just the bland flavors, and sometimes that's easier. It's not much of a surprise. It's expected. I know what it is. I know what to expect. I don't want anything new. I don't want anything different. And those are kids that have the bland, have the crackers. They're the carb kids, the crackers, and the sometimes the potatoes, sometimes just the French fries and the chicken nuggets and no sauce, no flavor. And so the kids have different tastes that we'll talk about a little bit how we can expand. So sometimes you may want to make some subtle changes, using butter versus the olive oil, or using the olive oil when you've used the butter in the past, adding smaller amounts of the new flavor. If you're going to change the flavor of something, slowly add it. It may be a teaspoon, it may be 1/8 of a teaspoon, 1/2 of a teaspoon of something. Diluting a new flavor. If you're changing the flavor of the juice that you're giving them, you may want to dilute it or slowly transfer it into the apple juice that they're drinking. A lot of times you may want to have the kids, before they taste it, try touching it or smelling it or licking it first before they even get to taste it. Textures of foods. I have a few kids I work with who will tell me foods are too slimy, they're too wet. That strawberry is too wet. So we've taken a paper towel and we've dried it off, and sure enough, the strawberry juice is on the paper towel. Oh, you're right, it is wet today. See if we can dry it off. We'll make it more dry, and then that piece is better able to be consumed. It's the perception of what the kids see in the food. If it looks wet, let's dry it off. How do you think we could dry it off? Also, chewy foods. Sometimes, again, oral motor may turn in and they may not be able to chew that long. There could be foods that are too chewy. I love steak, but if you give me a big piece and I have to constantly chew it and chew it and chew it and chew it, pretty soon it's not going to be worth it and I don't want to eat anymore. There are also some foods. I don't have a whole lot of kids, a whole lot of kids getting them to eat mashed potatoes. If your child likes mashed potatoes, that's awesome. But some of the kids, they gag. And if you think about it, the next time you eat mashed potatoes, see how easy it is to clear that from your mouth. So sometimes people drink something, people eat something else to clear that mashed potato out. So you just want to make sure that you are thinking about how the food is in their mouth. So that may be why I can't get it out of my mouth. So I don't want to eat that food. Some strategies that we've used, again, decrease the size of the bite if it's a new texture or something different that they're trying. I also use the side of the mouth. So teeth are very strong, teeth are very brave. Tongue is not so brave. Tongue can be a little scared at times, and that's okay, but our teeth are brave. Your teeth could try that piece. I'm sure your teeth could try it. So sometimes biting from the side also doesn't trigger the gag, because the gag would be in the center. So if you can get it to the side, and I'll tell some of the kids I work with, get it to the side, get it, and you'll see them dumping their head, get it to the side. And sure enough, they didn't gag. But that can be one of the strategies. Also, being able to spit out a taste. Sometimes kids think if I put it in my mouth, I have to swallow it. I can't swallow it, so I'm not even going to taste it. So having the ability to be able to spit out that piece of food is sometimes very helpful to some kids. Oh, I don't have to eat it? Oh, you don't even have to eat it. Let's just try it. You want to spit it out? Spit it out. And I would make sure that you have a place to spit it out so they're not spitting it out in the food, the rest of the food. So sometimes we have a bowl, or we have a garbage can close, they can go to the garbage and spit it out. A bag, something that they're able to get rid of that food. And then pretty soon it's like, oh, we got them to taste it. We got them to put it in their mouth, and that's okay. Spit it out. That's okay. Try it again. And my idea, one of my rules when we try things in therapy is to try it 3 times. The lucky number 3. And the first time I tell the kids, your mouth can be nervous, and you're nervous. So you don't really get to taste it because it's the first time that you put it in your mouth. So let's do it again. And so they try it a second time, and we give ratings. Yes, it's good. It's okay. I didn't like it. And then we try it. Okay, the other side of your mouth didn't get a chance to try it. Let's try it on the other side. So they do, okay, that's number 2. And sometimes I have some kids that I have to write it down. I have to mark it down. And making tally marks can be exciting too. And then the third time, then they give it a ranking. Oh, it's okay. Oh, that's great. You think it was at least okay? Oh, good. And then we try it a third time. Now your mouth is a little bit used to it. Let's do it the third time and see what it says. What do you think it's going to be? And I had one little boy said, okay, I need a drum roll. So we did a drum roll and we got ready, and he went, oh, almost there. So there's some different ways of trying to work on texture. So I've gotten them to try it 3 times. Sometimes they spit out the first 2, they chew the second one. Do you think you could swallow it? Okay, well, let's not. It's okay. You don't have to swallow it. But if you can, that would be cool. and then I could circle it that you swallowed it. So different strategies that we use. And also a cloth at the table. A lot of kids want to be able to wipe that off. Ooh, it's on my hand, so it's not on their pants, they're wiping it off, or it's on their shirt, or they're wiping their mouth. You have a cloth. If you want to wipe it off, that's great. Use your cloth. Use your napkin. Use something. This is a big thing. Some parents say, how long do I try? How long do I keep presenting the carrots, the sweet potatoes? So research says 8 to 12 different mealtime presentations. Not 8 times at dinner, 8 different lunch or dinner or snacks or breakfast times before they might be comfortable with it and they might try it. So then it becomes something that they've seen before. Oh, well, you put 3, oh, you got 3 peas on your plate today? That's great. And so Jenny Friedman, who's a nutritionist, one of the nutritionists that deals with kids on the autism spectrum online, she has said that her research says that parents usually stop after 4 times. And so you have to keep at it. It's not a really quick process, and it can be gradual and slow, but you can be happy with the little successes and the little things that might happen, but 8 to 12 different times. Sometimes you have kids that like to have charts, like to keep charts. They can chart which food that they tried and how many times they tried it. It can be also, we'll talk about later, presented in different ways. Maybe they don't like it because of the way it's been presented. So some other strategies. Another one that Jen Friedman says is rotate the foods. And this is hard, and I know for those of you kids that only eat 5 different foods or 4 different foods, or don't offer the same food 2 days in a row. So if you're offering, they're eating this new brand of chicken nuggets. Okay, I'm gonna buy 5 boxes and we're gonna have it at breakfast, lunch, dinner, breakfast, lunch, dinner. Pretty soon, they're gonna be satiated with that flavor, that taste, or that thing, and they're not gonna want it anymore. Just like you like supreme pizza. I'm gonna have that, you have that, you have that, and you have leftovers, and then the 3rd time you're like, oh, I can't have pizza again. Let's have something else. Well, to them, they may be able to last longer, but pretty soon that food, if it's offered every day, every meal, is gonna go by the wayside, and then we've got one less food. So you can have that tomorrow. We're gonna have that tomorrow. We're gonna try this today. You're gonna have this today. Remember you like the peanut butter and you like the chicken nuggets. And so yesterday we had chicken nuggets. So today we're going to have this. Freezing extra foods to serve again later. I know some parents have told me, I'm wasting so much food. They don't like it. We bought 5 different kinds of, he said he wanted a bagel. We got 5 different kinds, and then he didn't want any. Freeze the extra foods when you can to serve later. I have kids that are just trying foods that we've put them in an ice cube tray and put the different ones. So then you're just taking that frozen cube out, and it can thaw if you're at that stage where they're just trying little pieces of things, or you've got bigger helpings that you can freeze to serve again later. Be encouraging. I'm glad you tried it, instead of, oh yeah, I know you're not going to eat this. I know you're not going to like it. And it's hard. I know it's hard if it's day after day, but the more encouraging, the more positive that you can be, the better it will pay off later. Resist giving too many snacks. And we talked about a little bit before about grazing. Sometimes the kids will fill up on the snacks and then not be hungry for lunch or not be hungry for dinner. So decide on how much, a 1/4 cup, 1/2 cup of something. If they want more, okay, we gotta wait. We're gonna have lunch in an hour. We're gonna have lunch in an hour and a half. Let's go. You can distract them by getting them something else. Sometimes the kids know exactly where the food is, and so they go and get it themselves. I've had some kids put some parents put locks on refrigerators or locks on pantries or whatever. Otherwise, food is gone. So it all depends on what you need to do to limit the snacks. And again, talking during meals, sometimes getting them to think about something else for those of the kids that are verbal can be helpful to get them to talk about if we could, where do we want to go? If we want to do a visit, right now it would be if we go for a ride in the car, where should we go? Can't get out, but we can go for a ride. Where should we go? And also, or what famous person would you like to meet? Some kind of question that gets them thinking while they're eating. Think of it like when you're in the theater and you get a snack and you're eating while you're watching the movie. Sometimes you can get them to think about something else. Permission, some things to think about. Allow kids to touch, feel, and play with the food as an activity. You might want to not do it during dinner, but you may want to have a food, you're playing with it. You've got something back, you came back from the store and you're washing all the fruits off. And do you know how this feels in the middle? Ew, how does that feel? Oh, that's kind of soft. What does that remind you of? To be able to play with the food, to touch it, to crack an egg and let the egg go over and clean it up, but let them kind of play around with some of the food. Allowing kids to taste without having to eat it. We talked about that before. That can set a lot of anxiety, can reduce a lot of the anxiety if they know, I don't have to eat it, but I can try it. I'm going to take that bite. We put it, like we said, an extra bowl to put taste in, or some families, we talk about a no thank you bite. So if we're going somewhere, we have a meal, we have to do one bite. We don't have to like it. We don't have to eat it. Not everybody likes everything, but we need to take a no thank you bite. So it all depends on where your kids are at as to what some of these strategies can work. And then also allow kids to use dip or sauces. I had one little boy a few years ago that everything was ketchup. Ketchup this, ketchup on, you name it, he had ketchup on it. He ate it. The parents were like, oh, the ketchup, I can't stand ketchup with oranges. But I said, well, do you want them to eat the food or not? What's your goal? So if your goal is for them to eat the food, then if they like it with that sauce on it, they like it with ranch, everything's got ranch on it. Sometimes those bold, your kid is a dipper and does like to dip food. Sometimes giving the bolder flavors of dip, barbecue sauce, a mild, medium, hot sauce. Seeing if one of the things that you can try is if your kids get out a lemon or a lime and give them a piece, and if they eat it and like it, and they're not giving you the lemon face, then you know that they need some stronger flavors. That if they like, oh, I eat lemons. Lemons are great. This is good. Then you know that they're probably going to like more of the bolder flavors of food. And that means getting more of the seasonings out and making things more flavorful for those kids. And some of the strategies are food variety over volume. So you want to look at, do they eat 2 hot dogs but then nothing else? Or you eat a hot dog and you eat 2 pieces of peaches, and then you eat this, and then you can have your second hot dog. So sometimes the variety over the food volume is helpful to getting them to expand what number of foods that they eat. And we also use a first then approach. And first, like I said, first have 1 hot dog, then you need to try 2 more things, then you can have the second hot dog. Or first you need to eat your lunch today, and you know it's something that they like, you know it's something that they are going to want to eat, then you can go have your iPad time, or then you can go play with the truck, something that they like. And that brings me to the third point, is needing to find their motivator. What motivates them to eat? What motivates them to try? I tell the story to some of my colleagues. Is I had a boy that was telling me all the way down the hall how he wasn't going to eat the cottage cheese. He's not eating the cottage cheese. He is not. This is not something, I don't know why my mom put it in here, but we are not eating my cottage cheese. Okay. What we had talked about previously was he likes donuts. I had mini donuts for him. I said, okay, it's fine. We'll just eat the mini donuts later. No big deal. Okay. What? I can't have my donuts? No, it's okay. You don't want to eat the cottage cheese? It's fine. We'll leave it for another day. It's not a big deal. Oh. And then he knew my strategies because he had seen me for a while. Well, what if I taste it? What if I just taste that cottage cheese? Well, okay, here's a piece of the donut. Sure, if you want to taste it. Oh. I said, it's okay, don't worry, no big deal. I'll put the donuts in the drawer for next week, no big deal. We'll get new ones, no big deal. Well, what if I just have 1 spoon of the cottage cheese? See, his real motivation was the donut. Sometimes it's food. And I said, well, then I could give you half of the donut. Sure. Okay, so he turned around and he ate his little thing of cottage cheese and he said, there, now can I have my donuts? And so he got his donuts, but that was his motivator. Sometimes it's kids, it's other food for kids is a motivator. Sometimes it's to be able to do something. Sometimes it's to be able not to do something. Sometimes that's a motivator for some kids. Motivator's probably going to change. It won't be the same thing. But when you know that kids like it, there's not a gag, there's not a thing. You know that it's just that they're just don't want to take the time to eat or don't want, then you're, well, I guess we just don't do that today. Or I guess we just don't have that cupcake today. It's okay. I'll put it in the freezer. I'll put it in the fridge till later. No big deal. And sometimes finding their motivator, a lot of times finding their motivator is key to some of the picky eaters to be able to try things. I wanted to touch a little bit on food chaining. And this is taking Sherry Fraker, and they are at Cookie Mills in Springfield, Illinois, so they're pretty close to us. They have developed food chaining, and it's going from a known to a process to get to another food. So sometimes it's expanding just one food, like chicken nuggets I have, to a chicken leg and to shredded chicken. Maybe we move because they're only eating the chicken nuggets. So it's a way of branching the same flavor, the same type of food into different ways of being served. I showed pictures at the bottom. So sometimes it's going from French fries, the kids will eat French fries, all the way to we want them to do sweet potatoes. So then we look at sweet potato fries. So there are a lot of ways you can make your own sweet potato fries in the oven. You can get a bag of sweet potato fries. It all depends. Depends on how you season them. And then we can move, if we move then to the sweet potato fries, because we like fries, we're moving to different flavored fries. And then can we move to the cubes of sweet potatoes? We may not ever get to the mashed sweet potatoes, but maybe we'll be able to get to, we've even tried sweet potato chips with some kids because they like chips. So it's potato chips, sweet potato chips, and then we try the fries. So it's different ways of chaining a known food to expand that food. Chocolate brownies, any of the kids like the brownies or the chocolate chip cookie dough, the brownie batter. And there is a newer type of hummus out called brownie batter hummus. I don't know if I've seen it anywhere. I have seen it at Aldi. I've had some kids try the brownie batter. I go, it's like do you like brownies? Yeah, I like brownies. Well, let's get a different brownie. And I don't always show them. I don't lie to them, but I don't show them the packaging. So I get it out and I scoop it and I put a spoon out and let's try it. Let's see. I don't know. I've never tried this. Let's see what it tastes like. The first time that I tried it, I didn't try it either. And one of the boys said, oh, it's a different kind of chocolate, but I kind of like it. So we were able to get him to have hummus, which are chickpeas, but with chocolate. So branching that is what food chaining is about. And preferring to drink their nutrition. Some kids have a nutritional supplement. And what I like to do is say, start the day with a small amount of water. It could be a little juice cup. It could be a couple ounces of water. That sets the digestion going and sets the body ready to digest food, and it's a cleansing. Water is very cleansing. So I like to always suggest starting the day with some water. And then sometimes it's, you have to have water first, then you can have your milk, then you can have your juice, but you need this much water, a little bit of water first. Try to offer water during meals. Jen Friedman also suggests waiting with the milk until after the meal. If they've had the milk, if the milk is the first thing in their mouth when they wake up, it's very filling. So then why would I want to eat? I'm full enough. I really don't want any food right now because I've just had milk. Sometimes it may be working to dilute the milk. At first you're like, well, he will have a fit. He will have to have the milk. Will we dilute it? This is all that we have left. We only have this much milk left. Oh no, that's what you get. And there's water here. If you want it, it's right here. Water between meals is helpful. Diluting juice to get more water in. If you like, kids don't like water at all. Sometimes the Smart Waters, some of the bottled water, that Smart Water has electrolytes in it. Those don't have like an aftertaste. Some kids tell me that water has an aftertaste. And one of I think this is like the Sam's brand of water that is purified and has electrolytes in it. So it's almost like Gatorade without the flavor. No flavor of Gatorade, but it's a good thing if kids notice what's in the water. The water tastes chemically. The water tastes too much like I'm at the pool. That might be something to consider is what you have water-wise. Other people have put fruits in the water and made like a flavored water. Some foods to try. These are some foods that I've had pretty good success with getting kids to try. The snap peas, the raw snap peas, we break off the ends and sometimes we open it up. Sometimes we just take a bite from the side. I like to also use seasonings. I have we call it orange salt, which is like the Lowry's salt or the off-brand seasoned salt. Has been very successful with kids that think it just tastes like dirt or just doesn't taste like much of anything. Those are sweet peppers. Those are little peppers you can cut into rings. You can cut into smaller pieces, into slim, long pieces. For some kids, I've had to peel the skin off of, and then they will try it. And then that looks like popcorn, but it's cauliflower. And I've had some kids that have been successful with cauliflower before we've gone on to trees or broccoli. And some kids like it raw, some kids like it cooked. I used to have it, my mom used to serve it with cheese, melted cheese on top, and got us to eat stuff by putting a lot of cheese on top. But that's different ways of making. And then for those kids that don't like fruit, we've tried with and a lot of those kids that don't like fruit, it's the wetness, how much surprise there is when you bite into it and it's juicy and it squirts in your mouth. So a lot of times I've had some success with the dried fruits. Again, not giving them a whole apricot, cutting into long, little slender pieces that they can chew, swallow. Dried mango has been good. I always or usually have that on hand. Sometimes dried cherries. They come, again, just because I've been shopping at Aldi. I haven't gone there lately because they haven't been following the social distancing as much at Aldi. so I'll wait a little while. But when you first walk in, there's dried fruits there, and there's different dried fruits that you can try. Meats to try. Some kids are no meat. Bacon. We all think bacon's, most of us, bacon's pretty good. You might want to find out if they like it. Usually the kids like it real crunchy. Those that like to crunch things, that like chips and things like that, they'll eat the little pieces of bacon if they're crunchy. Some kids will eat it chewy. Some that don't like chewy foods, they won't eat it, but they'll eat it crunchy, like bacon bits, or when you overcook the bacon. Deli meats are also good, shaved. Sometimes the kids will eat pieces of pepperoni. You can build on pepperoni with salami. You can build on maybe pastrami. You can build in that that area of taking one type of deli meat, moving to the other. I've had some pretty good success with shaved turkey. That has been good, shaved or grated, or cubed, little cubes that again, put on the side. I've had kids that have taken really, really tiny little pieces of the meat, and we've worked on little pieces, and it was a success when they took two little pieces, and then pretty soon they're taking a little bit more and taking a little bit more. But we've had success there. And again, with sausage, one thing to note about the sausage though is that try steaming it. A lot of times frying it, it's too tough, it's too chewy, or I don't like it as much. It doesn't look as pretty, but what you do is you put the sausage in the pan, you add some water and put a lid on it, and then you can steam it and cook it. And then it's really easy to take that casing off. So if it's the casing that they don't like on it, or it looks burnt, you burnt it. You burnt the sausage. I'm not eating it, it's burnt. Then you've got it more steamed where kids will eat it, because again, real easy to chew, swallow, cut it in little bites. Some kids put syrup. If they're a syrup person, a sweet person, trying the sausage with syrup can be something good. Also vary the preparation. So Melanie Potak says to blanch the veggies. It keeps them crunchy but more tender. So blanching is putting them in water, like steaming them shortly, not for a long period of time, where it takes the hardness off, but they're still crunchy. Try the slow cooker or pressure cooker. I've had really good success with chicken legs. Breasts are drier, chicken breasts are drier, but if you do legs or something, or even cook it in the crock pot or the slow cooker, then at our house, we call it melt in your mouth, melt off the bones. It just falls right off the bones, and the meat is very, very tender, and the kids tend to like it better when it's tender. Also, keeping foods moist. Sometimes the foods are too dried out. Pork gets dried out, chicken gets dried out, and they don't like it because you can't get it out of your mouth. It's chewing. So a lot of times reheating. Trick is to put water in the bottom when you're microwaving it. We had ham the other night that was frozen, and so I added some water in the bottom and put a top on it and heated it up, and it was moist, and it was good. It wasn't dried out. Fruit and veggie prep. So there's a lot of different ways to prep your vegetables, and Jen Friedman also listed several. You can roast them. You can, one's not on there is grilling. You can grill them, pureed, put them in the blender. Sometimes the fruit smoothies, you can add, one thing about fruit smoothies, you can add spinach or kale, and it changes the look a little bit, but doesn't change the flavor. And you can get in some vegetables that way. If they are really a smoothie one, they can even help you. And crinkle cut fries, things grated. And I've had kids work on no allergy to dairy, have worked on shreds of cheese. That's how fearful they were of the food. So they took the shreds of cheese and they would just, we eat 5 shreds today, yay, that's great. So it's a process that's getting started. It's something that they wouldn't even touch before, and now they can put it as a snack. Now they can have more of it when they were only eating 6 bites for 1 shred of cheese. You can add, as I mentioned before, you can add cheese. You can put things in noodles. Sometimes the veggies in noodles can help. One thing though, about some frozen vegetables are rubbery. So you want to be careful of that. Some depends on what texture they like. Sometimes the canned carrots are okay. Sometimes the canned peas are okay, and sometimes frozen is better because they're a little bit more crunchy. And we can shell them. We can take the shell off the pea and pop it in our mouth on the side and crunch it. And then I added some, I have to tell you, it's really hard to keep talking without people interjecting comments and things. So this is some ideas for food. Sometimes the food can be fun, and they might want to eat, let's just eat the nose. Let's just try one part of the tree. Let's try one piece of the branch. There's that bacon on a cupcake, and different ways to serve bananas. Just some ideas for those of you that want to try and get creative. I probably would put half of the berries on by that dog, and the kiwi and the woman is pretty cool. There are plates that are actually drawn like that. But some different ways of, maybe they'll eat a couple things or 2 things, or maybe it's a game. Don't eat their hair. Don't eat their hair. Oh, you just ate their hair. And it's all fun because they're eating, you ate her earrings. Something like that. See, here's some other ideas. They have ham and bread. Looks like cheese for the pirate flag. We've got some oranges, and one thing about oranges, I have more kids that like the mandarin oranges in the cup versus the actual mandarin orange because of all the pulp and the strings and things, and sometimes we just make smiles and suck the juice out, and then we never actually eat the part of it, and that's okay. That's good. That's a start. And these are the plates. I guess these at the bottom I thought were fun, that they drew different members of the family and dressed them up and gave them hair, and seems like something kind of fun for those of you that have more artistic abilities. And the upper left is easy peasy. Sometimes presentation of the food can help. The plates on the right, super duper cells, and you can dress them up. It's just a plain face, and you can put whatever kinds of food on there, so you can be silly about what you're eating. The one at the lower right is a compartmentalized game that they eat different things, and then the surprise is like a dessert at the end, and they have to eat what's in each segment before they can have the surprise at the end. So it's limiting. That looks like a lot of food. To some of my kids would think that that's way too much food in there. There might only be 1 or 2 things in each little compartment for some of the kids I work with, and then they get to the end. Utensils can even be different. And this is easypeasyfun.com. Sometimes the kids like the mats. Those mats are rubber, so it's very hard to pick them up and throw them for any of the kids that you have that are throwers. So sometimes you can put the different food. Where would you like to put the food? Sometimes you can do it. Sometimes you can have them decorate it. Those are very mini cups and tiny spoons for tasting. If you had some of those hors d'oeuvre spoons you can use, or these are rubbery little tasting spoons. They're for the little ones, but if you have kids that only want to taste a little bit, sometimes that's helpful. And they have a flour plate, which I have a flour plate at Carl that I use. We don't put nearly that much food in each compartment, but we try it with the different foods. Looking at time, we're doing great. And the online resources that I said, that you can Google them, and they have some really good, you can get in there, get on their newsletter list, and they'll give you some daily suggestions, weekly suggestions. I think Melanie has a daily blog, video blog that she does. And hopefully one of these strategies works. I think it's just taking it in small steps. I don't claim to know the answers to everything. Like trying to give you some suggestions. I hope you found one thing, at least one thing on here to try that maybe can help. And I also listed all the references that I used. And Jeannie, do we have any questions?
Well, thank you so much, Lisa. That was so informative and interesting. And I do think you probably did address a lot of the questions that people were having. I would like to open up the Q&A, the chat. So any of you who are thinking that they have something that they would like addressed, please go ahead and type that in. While we're waiting for people to formulate their questions, I took a look at the list of questions you all sent in when you registered. And Lisa, I was wondering if you could address, there were several questions that words like battle, forcing, struggle, refusing, these very strong words were being used. How do we avoid this type of experience during meals? I'm wondering if you could speak to that.
I think that forcing, when you start forcing kids, I can see, I've had a little boy that had a spoon aversion. It really wasn't oral aversion, but everybody kept shoving food into his mouth. So anytime he brought the spoon up, he turned his head. I gave him food on a washcloth, and he actually took a whole, this is a younger child, he actually took a whole jar of baby food off a washcloth. A clean one, but a washcloth, because so many people had been giving him spoons that he didn't like spoons. So I think that it depends on the child. Sometimes it's getting the food in their mouth. We have to see what we can do to getting food, getting them to taste it, because a lot of kids on the spectrum, if we can't even get it in their mouth, they don't even want to taste it. They can't experience the food. A lot of times being able to spit it out is helpful, because then they can get in and spit it or push it back out of their mouth. Some kids have had success that way. I don't know if I answered that.
Great. Yeah, but do you recommend that meal times, that parents stick to their guns and that meal times become more of a struggle or a battle? Or what do you recommend? What do you see the better results?
Well, I think for dinner, everybody's had a long day. I think for dinner, just having the food, like we had talked about before, a little piece of whatever's being served on the plate. It doesn't have to be eaten. It doesn't have to be touched, but on the plate, so they can see. It can be there visually. I think doing dinner time should be at just maybe one newer food, because everybody else is eating it, onto the side, but to have the foods that they usually like. I think lunch and breakfast are times when you're going to make a little bit more progress than dinner. Okay,
great. We do have several questions coming in. I'm trying to see if there's any themes here, but
I saw some on times of eating.
Yeah. What if a child doesn't eat much in the first 20 to 30 minutes?
Yeah, it all depends. You know your child best. Some kids take a while to get started. So that 20 to 30 minutes is a guideline, but having kids sit there for an hour is a long time. And it's probably not very pleasant. Some kids like to eat and be done because they want to go do that thing that they're going to do next, or they want to do this. Sometimes setting a timer for our kids on the spectrum, timers work well, and that we're going to sit at the table and we're going to talk a little bit more, or we're going to be together. And then when the timer goes off, then you can get down or be done, or sometimes that helps as well.
All right. A couple of questions about older kids, more adolescents, preteens. What suggestions do you have for them who are resistant to food? Especially, one says, especially once they can prepare food for themselves.
I've actually worked with some middle schoolers and some high schoolers at Carl, and we work. The parents aren't in the room. The parents come in later and we talk about what we tried and what we did. I think that being willing to try smaller portions, smaller pieces, and it's okay if they don't like it, if they try. Again, size really helps with a lot of the kids that I work with. A lot of their perception of food is, food's this big, but to them it's this big. And so keeping things off the table. We had Thanksgiving can be terrible for some of these kids. It's way too much food. People are like, oh, try this. Oh, you have to eat this. You have to try this. You have to eat this. So having the second plate approach where they can put the food on themselves, sometimes being in control of the food is helpful.
Okay. I kind of hear a theme here of what you're saying, that a success isn't necessarily a full meal or a full plate being eaten, but success is that they will interact with the food or show some interest in the food, and that might be enough for that time.
Yeah.
And then maybe introduce it again and maybe get a little bit farther. Is that
right?
Correct?
And if you expect it to change overnight, it's not. The little successes. And sometimes when the kids think that, okay, she was happy that I even tasted it today. She was happy that I even allowed it on my plate today. Oh, that's good. Okay, I'm getting somewhere. And sometimes then they'll maybe want to try it again because it wasn't a big deal. It wasn't as big of a deal. And I know we worry about calories and we worry about, food getting in, and there's some foods that you can beef up the calories with. I didn't talk about avocados. Avocados are good high fat food that can be blended with other things, guacamole if they like strong flavors, seasoned salt. So it can be prepared differently.
All right. So I think these kind of go together. There's a question here that a parent sometimes negotiates how many more bites they need to take before being done. And how do you feel about kids cleaning their plate? But then right under that, a parent asks, I've heard things about not bribing kids with dessert. What do you say about that?
Yeah,
and what would be the reason to offer dessert or not offer dessert? And so kind of this idea of setting an expectation, and what kind of advice would you?
Several of the experts say that the child's job is to tell us when they're done, and it's our job to cook the food, to prepare, to decide what's being eaten, and it's their job to tell you when they're done. How do we know that for every kid a half a cup of this is a serving, or you have to eat 3 of these chicken legs before you can be done? I don't really think that cleaning the plate with some of these kids is it. I think if they say they're done, okay, you're done. And if you really don't think they're done, you wrap it up, you put it in the fridge, and you say, okay, that's fine, you're done, okay. And then if in an hour or 40 minutes or 30 minutes, they say, I'm hungry. Okay, you've got 3, because you know that they've eaten. It's not that they don't like it. Okay, you've got 3 more pieces of that, and then you can finish your meal. So sometimes it's if you think that that's the issue, it's sometimes waiting for that to have something later, because then, oh, I get dessert, so then I'm going to have a big bowl of ice cream but I still didn't eat all of my veggies or my foods. So it's a fine line, but I don't think negotiation hurts. But I don't know about withholding all of the dessert. It may be that they get dessert, but you get a half of piece of the dessert. It may be something like that. It all depends.
Okay. I did like how you said, okay, you're going to take a bite of that. Well, then I'll give you a bite of the dessert.
Yeah. Yeah.
And I mean, that's a great thing to keep in mind.
Yeah.
Okay, you're going to eat 1 piece of meat. Well, then you can have 1 piece of cake.
Yeah.
I think that's wonderful. I love it. Okay. Another one, I think that's a good thing to talk about. A grandparent needs to increase their grandson's fiber because of issues with bowel movements. Any suggestions? And I wonder if this is something that do you tackle my question is, do you tackle the digestive issue first and then the feeding issue? Or do you try to
it
do it through
depends.
food?
I had an issue with a family member who said that they were constipated, so I quickly Googled foods that help with constipation. So those were fruits, and we talked about lentils, and be careful of how much caffeine is. Caffeine is a drying agent, and so that's not going to help you to go. Apple juice. So there's some things that we have that information readily available to us that would help with fiber if he likes the different fibers aside from having a supplement. And those are some things that I think will be helpful if he eats fruits. If he eats dried fruits, those can also help.
All right. But do you, when you see a child, that was the beginning of your presentation, what I look at the underlying issues. If someone is having difficulty with constipation, is that something that you would refer to the pediatrician for?
I think that that then they would need to try some things. I've actually tried, they're technically dried plums, so we don't call them prunes always in therapy. And it says on the package, dried plums. We're going to try some dried plums today. And sometimes I won't tell them what it is at first, but I won't lie, but I won't tell them. I said, try it first and I'll tell you what it is. Try it and tell me and then I'll tell you. And it's a small piece. I've had kids like prunes, but not the big whole prune. Just we've cut it into 4 or 5 long, slender pieces. And they're like, oh, this is pretty good. And it's on the side, and that can help too sometimes then, all of the medicines.
Great. This is a good question. She says it sounds like picky kids are pretty common, and I'm sure there are a lot of parents that just don't have the energy for the battle. At what point is it truly an issue that needs to be addressed?
I think when you're down to 4 foods, I think it's time to come see a specialist to kind of help you take the burden off. I think that if there's a weight issue with it, is time to seek. There are some kids that parents will tell me, oh, it's in the family. So-and-so's a picky eater. A lot of it's familial. There's somebody in the family that may have some picky eating. And couple of us are doing it together. The little girl gave the dad a piece of, I'll pass. Oh, Dad, you gotta try it. Come on, try it. So I had a mom gag behind when a certain food came out. And so sometimes it's familial. It's in the family. But I think it all depends on if you want them to try. I've had kids that it's just fruits and vegetables that they won't eat. They eat everything else, and then we work on because it's a neutral place. Sometimes I have families say they don't do what they do for you, they do for me at home, because they know where everything's at. They know what buttons to push, and they don't know really what's in the room of the therapist and what's going on there. So sometimes it helps when you're really frustrated and it's a battle between both of you. Sometimes that third person can help for at least a while.
Yeah. And probably asking your pediatrician if they think that
Sure.
nutrition's an issue.
Sure.
Last question, and if anyone has any more, please go ahead and post them. But she says, my son is 3 years old and is still drinking from his baby bottle. And he doesn't like new things being introduced to him like a sippy cup. Even if he sees me pour his favorite drink into the sippy, he'll refuse it. How do I teach him to transition to a sippy cup or a small regular cup?
I've had this quite a bit, but I would look at my first couple questions, and my speech pathology friends who are on here are going to laugh, is that, does he snore? Are there some other issues? Because the kids that have a difficult time from going from the bottle to a cup, and there's so many different kinds of sippy cups, are sometimes it's in front of their nose and they can't breathe. And so it might not be tonsils, but it just feels like they're cutting off the breathing because the cup comes up. So there are actually cutout cups that are called nosy cups. If you Google nosy cups, there's a cut in the cup so that when they drink it up, they can still see what's going on, but they can take little sips. Sometimes an open cup is better than a sippy cup. I know it's not something that you want the child to walk around with, but sometimes we've gone right to a open cup instead of a sippy. I don't know. I'd have to take a look. That would be a situation where kind of take a look at the kids individually to see what the reason is why they don't want to transfer. Sometimes it's making whatever's in the bottle less desirable. And then making whatever's in there, sometimes just leaving it out, leaving it there it is, and having only a little bit. And then when that's gone, here, this is out, this is here, this is ready. I don't know, it depends.
Yeah. It is hard when you haven't actually examined and seen the child.
Oh, yes. I see the straws. Yes, straws would definitely work. Straws are fun. One thing to know about straws is the width of the diameter makes it more difficult. So if it's a wider straw, it's going to be harder for them to be able to suck it up. So sometimes sticking in a juice box straw or sticking the straw inside those fun straws, I think can be helpful too. Yeah, that was a good point, Amy.
Yeah.
Hi, Amy.
Yeah, and Amy's got another really good point here. She said, just some encouragement. I've had quite a bit of success with two things: playing with foods, with dolls, Barbies, little people, and beginning to explore new foods that way. And then also redefining try it, a progression of using all the senses to interact with the food over time. Look at it first, then sit near it, eventually smell it, then touch it, hand a bite to someone, bring it to the lips, lick it, until eventually my daughter will put it in her mouth and swallow it. And I see Lisa nodding her head because she taught her all those things. Yeah.
Great. That's awesome, Amy. Thanks for interjecting that.
Yeah. Okay. And this mom says this child also won't use straws. So I think that comment about the breathing, seeing if there's an issue,
just to see.
And a theme really I've heard tonight is we need to look at the physiological first. Is there something wrong with the whole digestive tract looking at each piece, is that the first thing that we could try
Right.
and fix that's causing this
Right.
child to avoid things, and then we move on to some of the behavioral things. So
And I had some sensory kids. I had one little boy that said there were rocks on his strawberries. So sometimes the sensory system's way out of whack, and I sent him to OT to get more sensory processing, to get their sensory system more in a line, and then they come back and see me. But that was an eye-opener that day. Like, wow, rocks on there. Okay, so that's how off it was to him. He felt every little pebble on that strawberry. But
so
yeah.
is feeding therapy very frequently associated with occupational therapy?
It depends on what state, it depends on where you are. Some occupational therapists deal with food. Sometimes the speech pathologist does. Sometimes we work together. A lot of times they're interested in how it gets in the mouth. And there are a couple sessions where I've co-treated with OT to work on both at the same time. But it all depends on where you are and who's taken the courses and what their background is and who's tackling it.
All right. Looks like we're running out of questions. If there was one more thing, Lisa, that you could, or a statement that you could sum up to encourage these parents, what would it be?
Be happy about the little successes. Be happy about them doing one little thing more than they did the day before, and praise them. They're so used to being often teased at school if they're older or something, or siblings or something, and said that they can't do this, or he'll never eat that. Try to keep it positive and try to celebrate just them doing one little thing more than they did the other day. And pretty soon that will build. And if you get really frustrated, come see me.
That's great advice. I hope that, Lisa, did you put contact information on your slides?
No, but I am at Big Baby Straw Cup. No, I haven't seen those. Oh, the reflow cups. Yes, I have used the reflow cups. It's a little stopper that goes in the cup that slows the flow of the open top cup. It will, if you do throw it, it will come out. And if it falls over, sometimes the top comes out. But we can add that at the end.
Okay.
Can we
So what's going to happen to everyone who's asking about how they can capture this information? This session was recorded, and we will make that available to everyone who is registered. It will be on our website, the TAP website, as well as we will email you with the recorded version. So that will be a way for you to capture the slides. And we can also get Lisa's contact information in that email as well. Erin or anyone have anything to add to that?
No, I just want to thank Lisa. Thank you so much for joining us this evening. It was a wealth of information. You covered a lot of ground in a short amount of time, so I really do appreciate it. I could tell we had 39 people participating this evening, which I think is fantastic. So thank you everybody for taking this time out of your evening. Jeannie,
thanks for inviting me. Thanks.
It was fun to have you. And Jeannie, thank you. Did a great job facilitating that discussion. And thanks again to Dr. Erin Nabata for keeping us all technically connected and providing the taped version of this. He will work on editing it and making it available as soon as he has the time to get that up onto our web. So thank you, everybody. Have a wonderful evening and stay safe. Good night.
Good night.